I'm 77 years of age. I was diagnosed with an aggressive prostate cancer when I was 74. That was diagnosed for me by Dr. Prem Rashid, who I had been consulting for some years at that time, simply because I wanted to be treated and looked after by somebody who I trusted, who obviously knew what he was doing. Now, what happened when I was diagnosed was, of course, that I felt very confused and very resentful. I didn't know why this thing had got into my body, and I felt I had no control over it. And so what Prem said was, well, it's up to you where you go from here. And he said there are a series of events you can undertake. There are a number of treatments you can undertake, from a radical prostatectomy through brachytherapy, external beam radiation therapy, and so on. But he said, really, it's up to you and your wife to decide what you want to do. And he guided us through that. And we came to the conclusion, I suppose, after a lot of anguish, that really, for me, external beam radiation therapy was the way to go. The decision was made, but that gave us a problem because there was no way I could have that treatment in Port Macquarie. There was no unit here at that time that could do it. So on Prem's advice, we went to Newcastle. We relocated there for 2 months and were treated in the radiation oncology unit at the Newcastle Calvary Mater Hospital, and returned from that just before Christmas, reported back into Prem's care, and he looked after me during the period when we were trying to find out whether the treatment had worked or not. Let me make it quite clear that I wouldn't have chosen to go to Newcastle if I'd been able to receive that treatment in Port Macquarie, and particularly if I'd been able to receive that treatment under Prem's control. I have enormous confidence in him because I had been dealing with him for several years, not only as a patient, but also had been trying to arrange certain medical matters in conjunction with him during my time as a member of the New South Wales Parliament. And then he presented to my Rotary Club an absolutely engrossing presentation of a radical prostatectomy. The women at the Rotary Club were enjoying it, but the men were not. But what came through to me was here was somebody who was confident about what he was doing, and who wasn't simply promoting himself, but who was promoting the need for people to understand how prostate cancer worked, to understand that there were no symptoms in the early stages, but that if it was caught early enough after careful diagnosis, then it was totally curable. And that was why this is the doctor I wanted to see when my time came to find out whether I had prostate cancer or not. No symptoms. You don't have symptoms in the early stages, but I had a family history of it. My father died of it. His father died of it. Both my father's brothers had it. So I was right in the centre fire area, as you might call it, of inheriting the tendency towards prostate cancer, and of course it came to pass. As I say, the treatment ended on the day before Christmas Eve 2005, and we returned here to Port Macquarie. Saw Prem a couple of weeks later after the holiday break and so on, and the first thing he asked me was, "What's happening? Are you okay?" And I said, "Well, I think I am. I mean, I'm a little tired because that's a normal result, I think, of those daily radiation treatments. But apart from that, everything seems to be fine." So he said to me, "Well, I want you to have a PSA test every 3 months for the next couple of episodes and see what happens." And we went down a path together where he simply said to me, "Right, it's time for another test now, and then come back and see how we're going after that." I had no problems with incontinence. I did have not an incontinence problem, but as most people have in these situations, the need to go to the toilet fairly often during the day, more often than normally. But that was a very, very minor inconvenience for getting rid of a cancer which could have killed me. And in fact, by the time I was diagnosed, it was critical enough for me to be admitted to treatment in Newcastle in a matter of only 9 weeks. And the normal waiting period was much longer than that. So I had really no after effects. I've had no incontinence. I've had no other problems that I can identify. And at the last reading, my PSA reading was down to 0.2. It had been 6.7 at the time I was diagnosed, and it had got to that 6.7 in just 7 months from being negligible. So it came on quickly, it was treated quickly, and as I sit here today, I don't have a problem. No, I don't have it. As I say, I don't have any problems. That's the weird thing about it. I think I've been very lucky because I know there can be consequences, but I think the reason why I don't have problems, first of all, is because I was encouraged by my GP and by Prem to have 6 monthly PSA tests before I was diagnosed, not just yearly ones. In fact, at the rate, the velocity which is what they call it, the velocity with which my PSA reading increased. If I had waited for 12 months to have a test instead of 6 months, I might have been untreatable because it was really galloping. So from that point of view, I think I've been very lucky. I've had no major problems, but as I said, I think the reason for that is because under the counsel of a good doctor, I was keeping a very close check on myself, and we got that cancer as soon as it started to become a problem. And it's been treated, and it's not there anymore, thank goodness. I wasn't keen on the idea of a prostatectomy. I have only been in hospital at that stage, only been in hospital about 2 or 3 times in my life. And I suppose I have the average person's fear of surgery. You don't like the thought of something being cut around in your body. Also, I had seen the video, if you want to call it that Prem showed my Rotary Club. And I thought, well, I know it's a life-saving device, but if I can avoid it and still get rid of this cancer, then I'd rather take the other way. And the other best way for me was simply external beam radiation therapy. It's painless, it's non-invasive. In the long run, with health insurance, it cost me nothing, except, of course, that we had to live in Newcastle for 2 months. But that was a very small price to pay for continuing to live, and the alternative wasn't really very desirable. Since that time, and largely inspired by Prem and by his book on prostate cancer, my wife and I have been pretty well all over the northern half of New South Wales, addressing prostate cancer support groups, service clubs, anyone who'd listen to us, trying to get the message through to men that prostate cancer is the one cancer which can be treated and cured if you get it at the right time. So what we have been saying to people, to men, is for heaven's sake, if you're over 45, used to be 50, I think it's now 45, go and have a PSA test at least once a year. It's a simple test. It only takes a few minutes, a blood test. You can have it done with your cholesterol readings, your blood sugar readings, whatever else it is, and it costs you very, very little. Certainly it's not a guarantee, but it is certainly an early warning, a first warning that prostate cancer might be developing. And because prostate cancer develops fairly slowly, if you get that first early warning, you've got the chance of early treatment, and early treatment is just about 99.9% guaranteed to deal with the cancer. So what I'm saying to men is stop worrying about whether or not you're going to be seen as in some way unmanly or unclean. Don't be afraid of it, because if you are afraid of it, it'll beat you. What we're saying to men is know that it's there. Know that just because you have no symptoms doesn't mean a hell of a lot, because there are no symptoms to speak of in the early stages. But from 45 years of age onward, particularly if you have a first-degree male relative who's had it, you need to have a PSA test at least once every 12 months. Far too many men are dying of this. In Australia, it's something like 2.5 times the national road toll. And it's not necessary. 90% of the deaths could be avoided with that simple little test.